Thank you for tuning into my channel again. We now dive into chapter 5 of PMHNP 4th edition, Neuroanatomy, Neurophysiology, and Behavior. A tremendous expansion of knowledge about the brain has occurred in the past 2 decades. As more has been learned about the brain and its complex functioning, assessment and treatment for psychiatric disorders have been altered dramatically. Increasingly, the links among genetics altered brain anatomy and physiology and symptoms of psychiatric disorders have been identified. That's according to Sadok and Sadok 2015. We now have 2021 edition. Okay. Now, this chapter, what does it focus on? It focuses on the basic anatomy and physiology that provides scientific rationale for many of the psychiatric mental health nurse practitioner care practices, including psychopharmacological interventions described elsewhere in this review book. PMHNPs need solid grounding in neurobiology. Increasingly, the roles of PMHNP requires the application of this knowledge to clinical practice. The nervous system, what is it about? Well, our thoughts, feelings, and actions are seated in and start with actions of the nervous system. Necessary for PMHNP's role of functioning is an understanding, like a deeper understanding of the basic anatomy. Remember, we mess with it. Whenever we give any medication, we are messing with the brain. How this drug works in their brain matters. We don't do trial and error. We shouldn't be doing that. So although sometimes it comes out to be that way, but we should understand the brain anatomy. That way we can properly provide care for our patients. Neurons, the basic cellular unit of the nervous system. Okay, look, components of the neuron, the cell body, that's pretty much the brain, the stem or the axon. Remember, A for away. The axon does what? Carries impulses away from the cell body. The dendrites, what does it do? It collects incoming signals and sends it towards the cell body. A for away, D goes towards. Okay, now, nervous system composed of 2 separate interconnected divisions. These are the CNS and the PNS. The CNS only contains what? The spinal cord and the brain. And the PNS contains a little bit more subdivisions, which we deal with a lot in neurobiology. You can go and review all my other videos. I pretty much discussed all this in details diagrammatically. Now, neuroanatomy of the brain. The brain tissue is categorized into white matter or gray matter. We don't really need to, this is not something we need to dive into so much for the exam. And the cerebrum, what is that? Remember, when we're talking about the cerebrum, it's not the same thing as cerebellum. Cerebrum is pretty much contains the left hemisphere and the right hemisphere. That is the 2 divisions of it. Remember, the hemispheres are important to be divided too, because sometimes whenever we see a bleed on the right side for stroke patients, the symptoms actually manifest on the left side. That's because coming down the tract, the brain decussates. Okay, now let's talk about the parts of the brain. There are 4 lobes of the cerebrum: the frontal lobe, the temporal lobe, occipital lobe, and the parietal lobe. Take a look at this frontal lobe though. You must be able to connect this frontal lobe to what? Executive function, as well as what? Dorsolateral prefrontal cortex. Again, I presented this in my previous videos. You may check it out and then you're going to find more information about that. I sent some clips on that. Cerebrum, you see all those highlights, very, very important to note. And also the brainstem is extremely important too. If there's any problem with this part of the brain, it can be really dangerous. Any part of the brain for that matter, it needs to be intact. Neurophysiology and the brain, we have what? The glial cells, the neurons, the cell body is the neuron, part of neuron is the cell body, and the dendrite and the axon, which we covered at the beginning of this chapter. But the glia and the neuron actually is what led to pharmacology. When you blow up the neuron, guess what it turns to? It turns to a big neuron, and then we're able to label it as what? Presynaptic and postsynaptic. Presynaptic is where something is coming from. Postsynaptic is where they are going to. Okay, so at the postsynaptic, there must be a receptor to receive whatever is coming from the presynaptic. Okay, and then it attaches, and that will be what? Agonist effect. And I also discussed more in my videos. Follow my playlist and check them out. Depolarization and repolarization, quite high yield on the exam also. And then let's talk about the monoamines and biogenic amines are dopamine, norepinephrine, and norepinephrine. You have to know that. dopamine, norepinephrine, serotonin. These are all our neurotransmitters. On your exam, there will be several neurotransmitters that will be discussed, which I also break down in my previous videos. All right. And then we have 7 neurotransmitters right here. Acetylcholine is what? Memory. Dopamine is what? Feel good. Norepinephrine is what? Fight or flight. Serotonin means sleep. GABA means chill out. Glutamate excites. Remember, bipolar patients are excited, so they're dancing around the pole. Opioid neuropeptides is pain, and that is commonly decreased in people with substance abuse. I teach you more on how to link this to life in my review. Well, I look forward to seeing you more in my watch my videos. Please subscribe to this channel to get more of this chapter's overview, just to help you break it down. You can be more comfortable studying this chapter. The last thing I want to mention is the what? Testing for the presence of HLA-B1502 allele in our Asian population. And I wish you the very best as you study your purple book. Remember also to study your case studies. And thank you for watching. Remember to hit subscribe button below. Have a wonderful day.